there are situations when you need medication, but let me tell you, medication is not your friend. Medication is not your friend. Only take it if you absolutely need to take it. The other day, in fact, I took antibiotics. I traveled back home. I came back. I had a cough. It couldn't go away, coughing and stuff. Those antibiotics messed me up, my friend. I was just like, medication is not your friend. Just know that.
Like if you've been trying to lose weight and you're having a tough time doing it, you can use it. But, like as someone in the medical field, what are your thoughts on this, or what is it that people maybe don't know about using this drug? Is it okay to use? Then you can now eat a few plants after taking Ozempic rather than eat a lot of nyama. Daktari, this is the One Mic Show. The other one part that I did not want us to lose, I know there's a lot of comments that are coming in here, but the other part that I did not want to lose, there's a lot of people, and I know you're advocating for food, plant-based food as medicine, but there's something called Ozempic. Yes. Yes. Let's talk about it. Let's talk about Ozempic. There's something called Ozempic that is being advertised and has become very popular. I mean, you'll see someone and then you'll see them a few months later claiming that, I've been working out. Oh, God is great. But they've been using Ozempic.
Nilienda Siberia.
Yeah, but they've been using Ozempic. So hii kitu inaitwa Ozempic, and there are people in the industry who are saying that it is safe. Like if you've been trying to lose weight and you're having a tough time doing it, you can use it. But, like as someone in the medical field, what are your thoughts on this, or what is it that people maybe don't know about using this drug? Is it okay to use? Then you can now eat a few plants after taking Ozempic rather than eat a lot of nyama. Daktari.
Right. And I want to say this with all due respect, because I am a trained doctor, and there are situations when you need medication. But let me tell you, medication is not your friend. Medication is not your friend. Only take it if you absolutely need to take it. The other day, in fact, I took antibiotics. I traveled back home. I came back. I had a cough. It couldn't go away, coughing and stuff. Those antibiotics messed me up, my friend. I was just like, medication is not your friend. Just know that. Whatever medication it is, let nobody tell you it's not candy. It's not fruit. So one thing I will say, people are getting on these medications and they're losing weight, and they're going to get side effects. In fact, I had a patient one time who came to the clinic and said they hadn't eaten for 4 days because the medication basically took their appetite away completely. They couldn't eat for 4 days.
And that's not psychological, right? That's just
slowing down. Also, the stomach slows down. So what happens, these medications, and let me tell you something interesting. Did you know that the mechanism of action, the way that Ozempic works and those medications, they work on these, they're called glucagon-like peptide. Where they act on, you can actually stimulate the same effect, but it's going to be in a much reduced effect from eating high fiber foods. And guess what? Fiber is only found in plants. You eat whole plants, you can stimulate the same effect of fullness, where you actually eat a little bit and you're like, oh, I just feel full, because you stretched out your stomach. When you ate that high fiber food, it stretched your stomach and it sends signals to your brain that you need to stop. It's satiety, right? So this Ozempic has the similar effect like eating high fiber food, but it's way stronger effect that also slows down your stomach emptying. And some of these people get what's called gastroparesis. Basically, the stomach just quiet. It doesn't move. It doesn't move. And there's so many other effects. You see how these people lose weight. There's even what's called Ozempic face. And I mean, this medications have side effects. And if you're struggling, yes, I do have patients that say, absolutely, I want the medication. Even when I cancel them and I'm like, we need to try the food, the diet, lifestyle and everything, they're like, no, I'm on the medication. I want to keep taking it. But I still do educate them that eat food that are high nutrients then. Because if your Ozempic that you took is making you eat only once a day, then you got to make most of it. You got to make the most out of the one time you eat. So I do push them and tell them you do need to eat more plants, because again, the nutrient density is higher in your plants and you're going to get more out of it.
All right, number to call 202-683-4570. Press star 5 to speak. So watu wa Ozempic mmesikia, like watu wanafanya hizi vitu, like I think even people sometimes go for certain kinds of surgery to make them, like look skinnier. And I think there's been a lot of confusion between the cosmetic, how you cosmetically look on the outside and what's really going on in the inside. I think there's a lot of focus on how people look outside, and that's why people sometimes are going for these medications where they're not really sure what side effects it's going to have, but as long as it makes them look good, they will go with that. Now, back to the issue, we've talked a lot about diet, like a little bit back to the menopause part. There's something called bioidentical hormone replacement therapy. What exactly is this, and is it a friend or foe when it comes to the management of menopause, Dr. Kanyaru?
Right. So, you know what, just a little bit though about the medication. So the way you want to approach this, like we said, yes, this is supposed to be a natural process, but if you come unprepared, quote unquote, you're carrying excess weight and you're having some mental issues and some stresses and stuff, all that is going to make it much harder, right? So we want to start as early as we can to prepare for this. And not only that, because remember, we are also wanting as much as possible to prevent, diabetes and hypertension. The youngest patient I had with diabetes was 9 years old. They didn't have type 1 diabetes, which is what you expect, that anybody who has diabetes that young is a type 1, which is actually an autoimmune disease. But no, this kid had type 2 diabetes and the kid was 200 pounds at 9 years old, right? 200 plus. So we want to start getting prepared to maintain healthy, weight, a healthy body with low inflammation, with blood, healthy blood vessels, healthy minds, healthy gut. We don't talk a lot about this, but a lot is happening with the gut, and it's called the second brain. You produce neurochemicals in your gut that affect your mood, your cognition, your memory. And guess what feeds that gut? Fiber. And there's no fiber in animal food, I must add. I'm coming back to that again. But so we want to get ready so we can go through this process as natural as possible. But what if everything fails? Like I said, pushing for a plant-based diet. But it's not just eating more plants or plant-based diet, decreasing your fat intake, right? We don't want all these fats or these oils and stuff. Actually, in fact, a study was done by a doctor called Neil Barnard. He wrote a book called Your Body in Balance. So women who are listening to me, please, especially if you're in America, you can get it on Amazon. It's called Your Body in Balance by Neil Barnard. So this doctor, he actually accidentally ended up doing this study because he was dealing with this patient who has an endometriosis. And I know you talked about endometriosis before. And that also is a disease that is driven by estrogen and animal product consumption. But okay, we're not going to do that today. Let me just go back. So we're going to make sure that we have healthy bodies, healthy weight, we're eating healthy, but we're also exercising, we're managing stress, we are not drinking alcohol, cigarettes and drugs and all these different things. We are being hydrated and we're getting sunlight. This is one thing that we don't realize, but it's very healthy to get sunlight. It affects our blood pressure, our immune system, our mood. Go outside, get some 15-30 minutes of sunlight exposure, go walk, jog or do something outside. So getting clean air, trust in God and, faith, social connection is very important, and time in nature. These are all things that we need to have in our lifestyle to make sure that we are staying healthy, right? Mentally, physically, spiritually, all these things. So let's say you try everything and, it's not working and you don't have contraindications. So if you have had breast cancer, if you have had endometrial, uterine cancer, you are not a candidate to receive any hormone replacement because these are hormone sensitive cancers, right? So you're not going to do that. But let's say you don't, or if you had a stroke or you've had, heart attack, these kind of blood clots, blood clot stuff. So you're not going to be a candidate for that. So let's say everything is fine, you can get it, and you're having severe symptoms. This is not something like we were talking about Ozempic. This is not something you're going to say like, oh, yeah, I can go get it. No, there is a little bit increased risk of cancer when you use hormone replacement therapy. There's increased risk of strokes and heart attacks and these kinds of things. But when I look from a medical standpoint, they do use them because some people are just so miserable that they're like, I'm just willing to do something, I'm willing to do something, nothing is working. And they say that, of course, there are those systemic ones, oral, that you can take, but sometimes we just minimize to vaginal type, hormone replacement. It does have less absorption and stuff. And, some of these women, like I said, they're having dryness, or they're having just pelvic floor issues. They're having urinary tract infection again and again. They're having falling things, all this. So this is something that can be done for sure. If nothing is working and you're miserable, this is something you can get, because again, it's all about risk and benefit, right? Risk and benefit. What are you getting out of this? So yes.